The COVID-19 pandemic has wreaked economic and social havoc on our nation, infecting over 12,000 persons and killing over 300. But amid the stories of mass unemployment, the crash of the tourism industry, an economy in peril, and seemingly endless desperation, there is an inspiring story that must be told. That of the Ministry of Health and Wellness, which against all odds has managed to contain the spread of COVID-19 in Belize.
We can breathe a little. At least our healthcare providers, that they were so overwhelmed seeing so many people die. It's not easy for a healthcare worker to come in every day and have to deal with death and the critical state of a person. So this is very much welcomed. Our hospital admissions are at an all-time low.
The numbers are going down, that's for sure. We're seeing less admissions. Private sector has not had many admissions as well. So we see everything around us is telling us that the transmission has been broken to a large degree. But in order for us to say that our country has recovered or is in the recovery phase, we've got to be at 5 or less with regards to positivity rate for at least 28 days. So we're not there yet.
Nurse Lorna Perez and Dr. Melissa Diaz are just two of the persons who have played critical roles on the fight against a deadly pandemic which visited Belize in early 2020 and never left. Perez is responsible for surveillance, which may sound trivial, but actually includes tracking the health status of the country, the pandemic, and its progression.
We're looking at identifying cases and at reporting the cases and describing that case, telling us, okay, what are we looking for? What are we looking at? Is it widespread? Are we having what we call clusters? Are these mostly adults? Are they children? Are they the elderly? Are they males, females? So we keep track of how this disease is evolving. Our teams on the ground will consist of the investigators, the contact tracers. You have your lab technicians who will run the tests. You have your doctors who will do the assessment of the patient, who will treat the patient, and then you have the intermediate care where if they need to be hospitalized, then they're hospitalized. So the information is being collected at every point.
Up to the end of November, that news was all bad. Steadily increasing infections and deaths were reported on a daily basis. Our public and private health systems were in critical condition, and there was such a backlog in testing that there were thousands of cases pending, with persons having to wait up to 3 weeks for results. Dr. Melissa Diaz took over as Acting Director of Health Services and as a priority restructured the way swabs and testings were handled.
So we were able to ensure that the supplies were available. We have actually been able to forecast and have constant swabs coming in, reagents. We were able to get more staff and put a good system in place where swabs for urgent cases were marked with a certain code, color code. Swabs from KHMH came in a different cooler so that the lab personnel knew how to process the different swabs and what was urgent, what was an emergency, and what was routine.
Today, PCR tests are returning results within 24 to 48 hours, and Diaz said that the next area of priority was the rollout of testing.
The more persons we test, the more positive cases we will find if they're out there, and the quicker we would isolate these persons. So we try to break the transmission of the spread. So we were able to roll out testing. We did an algorithm. The algorithm stated who can get rapid tests, who should get the PCR, and how we should advise patients who access care.
The testing at some point was only available at the health facility, and then people had to make long lines waiting for that service to happen. And so we have evolved, as I said, into what you refer to now. We're doing mobile testing, going into communities, going at some key locations within the districts to make it more accessible to the general public to come in and get tested.
Another new initiative, which was the brainchild of Minister of Health and Wellness, Michelle Shebat, was the implementation of a food assistance program, headed by nutritionist in the ministry, Robin Daly.
The food assistance program for COVID-19 patients is a program that was initiated by the Minister of Health to be able to assist patients that are COVID-19 positive. The objective of the program is to be able to provide a little relief for those persons who have COVID, and also to ensure that they stay under quarantine. Many times food might be a reason for them to want to come out of quarantine. So if they have a food supply that could last them for the quarantine phase, which is 14 days, we are hoping that this would be able to encourage them to stay in.
Daly heads a small team which reaches out to persons who have tested COVID-19 positive and have been forced to stay in quarantine. She says that apart from assisting with a basic need, the program serves a nutritional one, since the items provided are carefully selected.
Many persons are having financial struggles right now, so once you're diagnosed, within 2 days you can have your food package. So that's very helpful to most persons that are in need. And sometimes it becomes stressful because for persons, if their entire family has COVID, so then it becomes a big help to them. So at least they know that they can get that food package, and they would be able to have some basic food for their families during this time.
With those things in place and the numbers steadily going down, it is clear that the Ministry of Health and Wellness has managed to slow, if not contain, the spread of the pandemic. So now, instead of waiting for information to come in, Dr. Diaz says they are out actively looking for new cases.
We try to look for cases. We go out into the communities. We do mobile testing. We're now doing testing in high-risk groups, like people working at the supermarkets, the banks, the construction workers, immigration, customs. Every day, all over the country, we have mobile teams going out.
Both Diaz and Perez say the success of the fight is due as much to the participation of the public as it is to the measures taken by the ministry since December. And of course, to the work done by the many persons who are working with the ministry in its fight, going above and beyond every day of the week.
There's so many things that are taken for granted when it comes to the Ministry of Health and Wellness by the general public. The amount of work, the amount of dedication that our staff have made over the last 6 months, and especially over the last 2 months when we've started the mobile testing.
To let us keep doing the things that we're doing, the positive things that we're doing, and don't feel so like, okay, this is it, we now can let down our guard and we can go party and we can remove our masks. And no, we still have vulnerable people in our communities. We still have the virus floating, even not in the amounts that we had before, but it's there. And until we get to that point where we can say COVID is under control, then maybe then we can go back, but we cannot let down our guard. That's the bottom line.